Hello and welcome to Global Healthcast, brought to you by Global Health Press. In this podcast series, we talk once a week about all kinds of infectious diseases, vaccines, and vaccination. I am Joe Schmitt, and with me is Dr. Melvin Sanicas. Good morning, Melvin.
Good morning, Professor Schmidt, and good afternoon or good evening, everyone, depending on your time zone.
And here are our topics for today. Melvin gives you the COVID-19 update, and he will cover current variants of concern. We will look at Omicron subvariants in India, comparing that to the situation in China. We will talk about long COVID and the impact of vaccination on long COVID. And I will cover anything that happens after COVID. Is this post-COVID? And then I will inform you about DON, which is 24 years old, and it is the disease outbreak news produced by WHO. With that, Melvin, what is the COVID situation around the globe today?
So, for those who have been watching us for the past 26 episodes, you know that we start with a global COVID epi update. We get this from the WHO COVID situation report. This is not real time. And for this one, this is actually not just a week late. We know that we just had the year-end holiday season, right? So bear in mind that the data we show here, especially for the most recent weeks, are incomplete, and some of them they look that like they're decreasing, but they may change as updated information is added. But we can see here in this report that globally, nearly 2.8 million new cases and over 13,000 deaths were reported in the previous week, and that's actually an increase in terms of cases, but a decrease in number of deaths from the previous week. And if you go to the next slide, which will show the countries in a map, which will give us a better idea of the cases, right? At the country level, the highest numbers of new weekly cases were reported from Japan, from the United States, from the Republic of Korea, from Australia, and from China. And we will talk more about China in the next few slides. But I think this is just to show us that these are the countries that have reported increase in number of cases. On the following slide, you will see the number of deaths. In terms of deaths, you will notice here on this the image that the highest number of new weekly deaths were reported from the US, from Japan, from China, Australia. So basically the same countries that reported the highest number of cases, but you will see also France. France is included in the top 5 of countries in terms of deaths.
Very interesting. And I guess these are the this is a waning COVID situation, except for some countries like China, where after the Chinese New Year, that just is over, I would expect to see an increase of cases in the next 2 weeks, right?
Yeah. So in China, as you may remember, for those who have been watching, as we mentioned 2 weeks ago, that we have no idea what's happening in China, right? That but we know that they've changed their policy early in December. They've basically now have stopped their zero COVID policy. And then we have learned that nearly 60,000 people with COVID have died since early December in China. And this was not reported as they happened. And also we have learned that the way they counted deaths for COVID has changed a bit as well. And so I think we will be learning more about the numbers in China in the next few weeks, because at the moment, WHO is working with them to sort of sort out these numbers. We also have, we also have learned that in some provinces in China, public hospitals have actually discouraged people from putting COVID as the cause of death on the death certificates. So all these things will be sorted out, I'm sure, or I hope.
Very good. We'll hear more about that. But then one of the worries with this particularly large outbreak is that there may be new variants. So I think you have some slides on new variants to inform us where we are.
Yes, so really this is just something that I added here because I think it's really good for us to remember that we are now in also a different era in terms of COVID. Last year we were talking about just Omicron as a single entity, and then before that we were talking about the alpha, beta, gamma. Now we are talking about all these subvariants and variants of Omicron, right? Compared to their parent lineages, laboratory evidence shows that these different descendants of Omicron, so we have BQ1, BQ11, BF7, and BA2.7 to 5.2, these ones can actually evade antibodies from vaccine or antibodies from infection. But it doesn't mean that it completely evades, right? So it's just that the neutralization is not as good as compared to if you're neutralizing the past versions of the virus. And so I think we don't need to remember all these numbers, right? It's difficult even for us who are sort of monitoring them. It's difficult to remember all these numbers and all these different mutations. But I would say that the thing that we should remember is that while these new subvariants are better at evading immunity compared to the previous ones, vaccines still work to prevent severe infection, and antivirals are still sensitive and capable of working against these subvariants, although the monoclonal antibodies are now no longer working against these new subvariants. And I think what's important is for us to remember that if you haven't gotten your bivalent booster yet, do so. Get it and be protected from all these new subvariants. I have received my bivalent booster early in December last year.
How well does does vaccination work against this XBB 1.5?
So not specifically for this, Professor. I don't think we have effectiveness data. It's all about the lab data, right? Neutralization. But looking at all these different Omicron subvariants, there was a review that was published recently looking at how vaccines are working against these new subvariants. Infection-wise, it's not as good, and we're not really surprised about that, right? But in terms of preventing hospitalization and severe disease, it's still high up there. So I think it's something that it gives us comfort.
Yeah, very nice. And now China.
Yes. So the reason why I wanted to show this is because the BF7 subvariant that's affecting China at the moment, it was actually first seen in India several months ago. So we could sort of compare the two countries because they are affected by these subvariants. But I think what we can see here is, or what we can observe in the next few weeks is maybe whether this BF7 will behave differently in a population that has been minimally exposed to the coronavirus as opposed to India, right? Where India didn't have the zero COVID policy. So people there have been vaccinated several times, boosted, and also have a hybrid immunity because they've also been infected by all these different variants like alpha, beta, delta, and even Omicron. So I think here we can sort of compare how the virus would affect a population that has been minimally exposed versus a population that has been exposed to several different generations of SARS-CoV-2.
Yeah, interesting view. Yeah, so this will keep us busy for one of the next meetings we have. And here you have now COVID or post-COVID or persistent COVID-19 symptoms.
Yes, so this is a publication that I think is interesting. The question here was what are the factors associated with persistent post-COVID-19 symptoms, and how do post-COVID-19 medical encounters change over time? And in this cohort, the finding is that in US adults, basically, at 6 months after the onset of symptoms, participants in the study had significantly higher risk of pulmonary, diabetes, neurological, and mental health encounters versus, of course, their pre-infection baseline. And what you will see here in the study as well is that COVID-19 is associated with increased healthcare encounters and visits to clinics, visits to hospitals through the 6 months after infection. And vaccination was associated with a lower risk of long-term COVID-19 symptoms. And I wanted to focus on this on the next slide. You will see a very small portion in the results saying that the benefit of vaccination after COVID to prevent long COVID is actually quite significant. It's a 40% reduction across multiple organ systems, including the lung, neurologic, and diabetes. So I think it's something that we should emphasize, because people are always talking about long COVID now, but what we can do is actually to get vaccinated to help reduce your risk.
Yeah, good point. And I think we stated again and again, COVID is not only a respiratory disease or a disease of the lungs, it is also a systemic disease. It may affect any organ. And we said that, I guess, early on, and here we are, and still covering the same topic. So if you get your vaccine, you not only prevent your respiratory tract, but any other organ, I guess, in the end, as it may be affected. Now, I have found a great review of long COVID, major findings, mechanisms, and recommendations. And basically, long COVID is very often debilitating symptoms, and it occurs in at least 10% of those with acute SARS-CoV-2 infection. At least 200 symptoms have been identified. And again, as I said before, basically any organ can be involved. And it is estimated that at least 65 million people in the world have long COVID. And this is a wonderful review with very many detailed data, and it is really worth reading. Although I have to say the issue with this article is the terminology. And this is a little bit difficult, but I'll come to that later on. Long COVID symptoms and impacts on numerous organs with different pathology. So in this pink here is the symptoms, and in blue is what you find with regard to pathology if you do the respective tests. Now, you may have chest pain and palpitations, and that relates to cardiac impairment, myocardial inflammation, and this is postural orthostatic tachycardia syndrome, which is a symptom and not a syndrome to begin with. But again, the terminology in this article is just difficult. And then it comes to the lungs, it comes to the immune system, it comes to the pancreas, and Melvin already mentioned diabetes can be one of the consequences of COVID infection. Gastrointestinal tract, abdominal pain, nausea, gut dysbiosis. I guess this is wrong because it should be microbioma or gut microbioma dysbiosis, because the gut is the way it was, the structure is still the same, but it's the microbioma that may change. Viral persistence, viral reservoir. Neurological symptoms are very numerous and affect different parts of our nervous system, the brain, the myelin, but also the nerval fibers. And this also has to be appreciated. Kidneys, we spoke about that in the past. There may be kidney failure, there may be liver problems or liver diseases. Then there is blood vessels, and the blood vessels serve each organ. And if you have a problem with circulation, what may you end up with is fatigue, because if the organ does not receive enough oxygen and blood and nutrients, in the end, there is not a normal function of this organ, and then you may be tired. So different items here. And then the reproductive system may result in erectile dysfunction. Maybe that convinces some of our male colleagues to get the vaccine here, right? and reduced sperm count. So it's relevant also to get the vaccine if you are a young man and still want to have children. Great review. They really all put it up here. And then 1 year after the initial infection, the likelihood or the hazard ratio for pulmonary embolism, cardiac arrest, heart failure, death, stroke, and diabetes is increased. Very important. And you see, it is really substantial, 3 times more to 1.3 times more for diabetes. So this is relevant, right? Dysautonomia, this I don't know. I mean, I guess they speak about the spots where you basically you're fainting when you raise up from sitting, and but dysautonomia is the wrong term for that. But anyway, breakthrough infection, they don't say is this breakthrough after vaccination or after a disease you have another burst of disease. It's not defined in the paper. But pulmonary, I don't know what this is. Pulmonary symptoms, pulmonary diseases, pulmonary dysfunction, what is it? And they have more of this here. The only thing you can say from this article, a lot of things happen after COVID, and unfortunately the terminology in this article is simply miserable, and it's difficult to make something out of medically. What is nice, they have 5 mechanisms how long COVID may occur, why it may come up. It may have to do with reactivation and viral replication. It may have to do with the bacteria in the gut that may change, and then you have a different microbiome in the gut which affects all of your body. You may have autoimmune disease. You may have changes in the circulation with blood clotting. And then there may be maybe differences in the neurological signaling. So this is all nice pathogenesis, and this is nicely summarized in this paper. Again, a lot of work and really well done. For children, they found this study in Denmark, for example, very rare. There's liver injury, pulmonary embolism. So this is all quite rare. But interestingly, COVID during pregnancy is associated with later neurodevelopmental diagnosis. Again, it's not one disease. It is many diseases, apparently, right? Adolescents may have problems, long-term pulmonary dysfunction, and children with long COVID may have attention deficit hyperactivity disorder, which you know. And several studies appear to indicate that children with COVID considerably frequently have no positive PCR and also less likely seroconvert. I'm not sure if this is right, and this is further substantiated. I worry that our recommendations to vaccinate children would be all wrong based on wrong numbers. But again, I guess this needs to be sorted out. Now, they also give recommendations for treatment. The problem is, if you have a disease, you have a treatment. If you have a symptom, you can use symptomatic treatment. But very often they mix this all up, and here they have symptoms and or biological mechanisms. So this is not one item that is there. This is broad groups. And then you cannot recommend one treatment, right? And for example, if for immune dysfunction, I would not even consider consulting an immunologist on implementation, because for treatment, I'm the expert as a physician. I don't need an immunologist unless it is a clinician who is trained in clinical diagnosis and treatment and knows the products that you could use. So it's a little bit challenging here what they're doing with this table here, and I really worry. And I would like to summarize this, that the authors mix up disease. A disease has causes, or one cause has a pathogenesis, and there are symptoms and findings. That is what the patient suffers from. But they mix up disease and illness with medical conditions, syndrome, symptoms, dysfunction, pathogenesis, mechanism, organ and organ system. And this is difficult to find out what is really meant in the end. And that may have to do with the literature they were reviewing, and maybe that if epidemiologists start taking over doing medical studies, medical epidemiology studies, maybe that's in the end what you get is nobody knows what they're talking about, right? Do they talk about disease or do they talk about a symptom? And very often, very frequently, authors mix up organisms and diseases. Influenza is a disease. Influenza virus is a pathogen. So this is all mixed up in the literature, and I hate it. But again, the article is great. Read it if you have some time. And I want to come to the next topic, which is disease outbreak news, which is something you find on the WHO website. And these authors here, they analyzed more than 2,700 articles that were published over the last 24 years. And what they found is that these reports cover persistent threats, persistent epidemics, and they recommend that these reports in the future should have qualitative and quantitative information. And they found that there is inconsistent reporting. Everybody has a different way how to report and what to report. And they suggest that there should be clear guidelines, what should be reported, and there should be standardized formats for reporting so that you can learn something about it. And the main thing certainly is how to prevent diseases in the future. Now, this is one of the graphs from this wonderful paper. The top 4 outbreaks over time are cholera. You see this here in this golden color. Then there is Ebola virus in this light green color here. You see influenza A and MERS coronavirus. So this is a nice way to look at the outbreaks and to see what is relevant over time. And in another table, you nicely see the top 25 diseases, 5 times 5, and I marked those for which we have a vaccine. And there's a substantial number. Cholera results from not separating sewage from drinking water, right? If you shit into your drinking water, you come down with cholera at some point. And this is easily preventable. So why do we have cholera outbreaks? Dengue, there are now 2 vaccines. Ebola, there is vaccination. Influenza, there have been vaccines for decades. There are measles outbreaks. That should have been stopped in the year 2000, but many countries, including many countries in Europe, never came up with high vaccine uptake. Meningococcal diseases disappeared here, and I think this is very nice. Maybe it has to do with reduced smoking, reduced contacts, I'm not sure, but meningococcal diseases really were waning. There's also vaccines and vaccination. Polio, there are outbreaks still, and that has to do with political situation in the country that have polio outbreaks in Africa and in Afghanistan. Okay. SARS-CoV-2 and then yellow fever, they are certainly a very good vaccine. In the end, it is a little bit devastating to see that there are so many easily preventable outbreaks, and why don't we do more, right? That would be the question, or what would need to be done that we can be better in the future. Melvin, I talked a lot. Any thoughts on the don'ts or any additional information?
No, I think specifically for this very nice graph here, I think it reminds us of the power of vaccines, and it also sort of makes us think that the situation now is quite different from, let's say, a decade ago, right? Or maybe more. Previously, the issues were we don't have vaccines, we don't have finances, resources to get the vaccines. Now it's more political issue. It's more of we don't want to get the vaccines because of misinformation and disinformation. So all these other things in the world have changed as well. So I think it's just a reminder for us working in science, public health, and medicine to also sort of change the way we look at these problems.
Yeah. Thanks, Melvin. And I think this brings us to our summary. The COVID-19 update was really that there are still deaths out there. The pandemic is not really over. There is a large number of cases expected to come after Chinese New Year. Melvin covered the current variants of concern about the subvariants in India and China. And we told you that COVID vaccination results in roughly 40% less long COVID. I told you about long COVID, about the summary article with a lot of data. It's worth reading, although the terminology is not very good and it's difficult to sort out what this all means. And then lastly, we covered 24 years of DOM, disease outbreak news. And in the future, hopefully we will have more structured outbreaks so that there is more learning. That is the end of our Global Health Cast today. Please write us which topics you would want us to discuss next week. You can download the PDFs of our show notes below in the link. Please like, share, or leave your comments below. Thanks for listening. I am Joe Schmitt, and with me today was
Melvin Sanicas. Thank you very much, everyone, and enjoy the rest of the week.
Bye-bye.
Bye-bye.